the probiotic which available in diet is predominantly milk based, right? So very difficult in some instances where you have milk related intolerance. So yeah, we have to.
And another point, you have to, for concentration and calmness, we have to bad, should avoid bad foods. That is very important. Actually, I think Arul Prakash will agree with me. The refined sugars, refined. I think every parent here is mastered the diet already. They know everything. They may be knowing more than me, depending on the child's challenge. So we are reading for the professional sake. They are reading for the child's sake. Okay, so they are very much aware of all those things. So depending on the child, I may be very much interested in chewing related things, because my child is having such things, such issues,
very true,
swallowing issues. So everybody knows what it is. I think the what is to be avoided is very important to make the kid calm
and concentrate. Yes. Moving on to the next question, I would like to know about deworming and how often we can do deworming, the food post deworming. Is it a must to give probiotic after each deworming?
I mean, deworming, the generalized protocol which pediatricians follow is giving once in 2 weeks, like, I mean, first dose and then after repeat after 15 days, and then they suggest that you can take this at 6 months interval till you get exposed to that. The kids are exposed to that pattern of getting exposed to that ovas and cysts. But there is no definite protocol. Okay. If you note that you are giving a food which is like well cooked and it's like clean, then it's likely to get in touch with the worm infestation. Okay. As Dr. Chezhian told, you are watching the stools every time, then you are seeing not that a pinworm or hookworm or something like that. You are not noticing that sort of thing. I don't think it's really a must. But if you have a strong, suspicion that you have seen something which is abnormal, or maybe what I say is once in a year, we can give deworming. And there are a lot of myths around deworming. What they feel is it just causes diarrhea, it troubles. You have to do, you have to take something after that. That's not true. And for that question of probiotic after deworming, it's not necessary. Worms are different from bacteria, so it's not going to interact in any way. What generally we give gastroenterology is we give this worm tablets for at least 3 consecutive days, because there are variety of worms which is present, which can cause. The commonest thing is this hookworm and pinworm. That is, it stays in the large intestine. It comes out of the anus and get back into it. So you deworm them along with other siblings. The family members have to take that, because this everyone get cleared at the time so that it doesn't get reinfected. And I don't think probiotic is necessary. Duration is, it depends on what we are targeting. But the general dictum is you do once and then repeat after 15 days. Okay. But if you come to a consultation and the problem is little serious, we will continue it for few days, 3 to 5 days we give. That's little, people are not used to that, but we do give because there are resistant infections.
Dr. So, Chezhian, if I may ask?
Actually, I think Arul Prakash said everything. To add one few points. The prophylactic deworming is WHO guidelines is applicable for countries with more than 50% incidence of worm infestation. I think our hygiene standards are improved a way better. But still, if the parents are nothing, no harm in giving that up to the age of 14. From the age of 1 up to the age of 14, you can give biannual deworming. As Arul Prakash said, you have to give for a whole family. And regarding the probiotics after deworming, some pediatricians are prescribing if the child develops taking that probiotics, because some are taking the deworming drug. Sometimes because of the deworming drug, the dead bacteria may release the dead worm may release some toxins that may cause diarrhea. In that case, probiotic may be selectively used for such kids.
Okay. Moving on, doctor. The next one, explain GFCF diet and its relevance in children with needs. If on diet, how to manage and supplement vital nutrients in a natural manner.
So in the recent years, there were a lot of controversy about gluten-free and wheat diets. Them better. But as such, if you go and see the common population, we don't have that much high number of gluten sensitivity in our population. So the role of gluten sensitivity or casein free diet is more individualized. That's what I mean. As I had a discussion with the neurologist, pediatric neurologist as well, what their consensus is also the same, that if you personally feel after taking wheat and wheat related products or something related to gluten, you have some sensitivity issues and behavioral changes, maybe you can look into that. Otherwise, I don't think there is a role for this thing as of now as a medical fraternity.
Yes. Dr. Chezhian, would you like to add your views?
Yeah, as a medical doctor, we will believe in scientific data and we follow the risk versus benefit ratio applies everywhere. As Arul Prakash said, so far the studies are lacking to implement because GFCF is the elimination. So my point is, if any other parent wants to try GFCF, it's okay because even though scientific evidence is lacking, this may be correct. GFCF may be helpful in certain things because some of the smaller studies are supporting the GFCF diet, but it is not proved in large scale studies. So it's not coming. It not came as a guideline to followed by every doctor. So, but one day if the research says enough, it may be coming as a guideline. Till then, if the mother and father, parent is the king, the child is okay with the GFC diet, they can follow that, no harm. But only thing is, you should not follow it on your own. You have to consult a dietitian because it's an elimination diet. Suppose if you eliminate certain things, the child should not land up in a nutritional deficient state. So you follow, but with the help of dietitian.
Yes, doctor. Yeah, the next question is also related to GFCF and it says, does it help in reducing anxiety or aggression when there is no intolerance and IG test being normal?
Sorry, what is that?
Does following GFCF diet help in anxiety or aggression when there is no known intolerance and IG test being normal? So yeah,
that's what we discussed.
Yes.
I mean, I think the evidence is not there. As Dr. Cherian said, there is no harm in eliminating and seeing. I mean, it's like a trial. If it works for you, that's well and good.
Good. Yes.
There may be very rare case reports or incidences, but if it happens to us, it's well and good. And we should get supplements. Like say, we should not lose the nutrients because of elimination. I think it's worth trying.
Okay. The next one, doctor, is diet for behavior issue.
I think everything is similar content.
Similar to the earlier one.
Similar to that only.
Yes. And I think the next one is also similar. What would a balanced diet for a 10-year-old child? This we have already addressed, doctor.
Yeah,
Shall we move on?
Dr. Cherian has told
he's
the balanced
very,
diet with...
it was very...
Balanced diet, I want to add a few points if they missed. Madam, we have how many time? What is it? Is there any time limit for us?
Doctor, we've reached 1 hour, but I think if Dr. Arul Prakash is also okay, we could go up to 4:30.
Yeah, that's fine.
Yes, doctor.
Okay. I have no time limit.
Thanks so much, but
the Zoom should not cut our practice. No.
We are taken care of there, doctor.
Taken care of, doctor. Don't worry.
Okay, ma'am. Regarding the food for behavior issues, as I already said, I want to re-emphasize. We should avoid certain things. Refined carbohydrates, white sugar, then processed food. Anything is prepared in the wheat home is okay, I think.
Yes.
That is the most important point I want to stress.
Yes, doctor. The next question, the 10-year-old child balanced diet. It's for everyone that but age
Yeah.
specific இது பண்ணல.
Water, as I said, no, it should be like adequate water, adequate fiber, adequate
yes.
vitamins, and the proportion which Dr. Chezhian told in carbohydrates, fats, and everything has its, even with fried foods, yes, they need actually. So, but it should be in a moderation.
Correct.
Yeah. It has to be individualized. Yeah.
Yes, doctor.
How to avoid bloating? I want to add one point. So we are more towards lot of fruits and vegetables. Lot of fibers also will cause bloating. So
exactly.
we may are very healthy, but if you take too much, it will be healthy. I know a patient who ate a lot of sprouts, ended up in very high discomfort. So anything is moderation is okay. So
exactly.
Fibers can cause, pulses may cause bloating. There are so many reasons. We have to approach the child with the help of a gastroenterologist at the time of the bloating. We can generalize things. Okay, that is
as you said, no, like a normal Indian diet has an adequate 30 gram, 15 to 30 gram of protein. So we don't need to add a fiber with that. So that much fiber is there in our diet. So adding anything will cause bloating. And we did forget about carbonated drinks. If you give something like a carbonated drinks, that's going to add to that. And sugary things is not a good thing, because there is something diet called FODMAP diet, where even otherwise adults and many children doesn't tolerate that sort of diets. Like we have to go for low FODMAP diet and try to avoid high FODMAP, which there was a lot of information on the net. There is a list of food, particularly onion, garlic. These causes a lot of bloating. And some fruits also, and sugary drinks, juices in excess also will cause problems. So we have to be very careful.
Yes.
So regarding the balance side, ma'am, one point is I want to add. So our diet should contain food from all the 4 common food groups. So we divide food into 4 groups. Maybe you are aware of. First thing is cereals, millets, and pulses and legumes. That is one group. Okay. Then our second group is milk products, and animal products. Those things are second group of food. Third one is fruit and green leafy vegetables and other roots. Everything is the another group. And finally, it is nuts, seeds, oil, and those things are finally. So our diet should contain all the ingredients together to make it. Another point is regarding the oil. I don't know actually till yesterday. So while referring on an article, I learned that actually the better for a better oil suggestion is blending. Actually, instead of using single oil, we have to use blended. We mix. I think already every kitchen we are using as blended oil only. Everything is mixed. Okay. Traditionally, we are following very good dietary practice in our Indian kitchen. Actually, that is from our forefathers. We got every good practices without knowing it as the benefit of it. Actually, that's what I stress.
Super. Doctor, அந்த questionலயே இன்னொரு part வந்து, if the child is hesitant to drink water, what is remedy?
Yes. Actually, I suggest 30 ml of water per kg. Suppose if water is the best liquid. If as much water he can take, let him take. Other alternatives are, you can take tender coconut water.
Okay.
Eat buttermilk. You can eat freshly prepared juices.
Okay.
And naturally, all the vegetable and fruits itself contain some amount of water. Or you can add the milk. You can have to take milk. Milk, at least the recommended milk intake per day is 150 ml. For those who is not on GFCF diet, I'm saying that recommended milk intake is at least 150 ml per day.
Yeah.
So milk, these things may substantiate the water intake.
Water content. Yes, doctor.
So how to monitor that is like how much water is adequate. It's very difficult. So what I will tell people, or like see the urine, and it should not be dark. If it is dark, then it's not adequate. So it should be like clear urine. Is that right, Dr. Chezhian? I mean, that's an indirect way to see whether.
Yes. I used to teach Anish that healthy urine is white colored. So initial days he will immediately after passing he used to come and say, "Daddy, I passed white urine." Okay, very good. Very good, Anish. Very good. And but Vishwa, my elder son used to drink a lot of water. I don't know whether over drinking of water will cause intoxication, but at that point
yeah,
you want
they do actually. It changes the sodium balance and it disturbs the neurological. So I mean, it's difficult if we are doing too much. We have to control it basically. Anything in moderation.
Moderation is good. Yeah. Yes, doctor. And what is the allowed quantity of direct sugar intake per day?
Yes, madam. That I read actually your nutrition guidelines. They said it is less than 5% of the calorie intake.
Oh.
So suppose, for example, if your calorie intake is 2,000 calories per day, less than 5%, but maybe some 5% out of 2,000 means.
ஒரு ஸ்பூனா டாக்டர்?
நமக்கு
அப்படிதான் புரியும். ஒரு ஸ்பூனா 2 ஸ்பூனா. 5%
message is try to avoid as much
sugar
as possible, because indirect sugars are very important. So we indirect sugars, we know carbonated drinks, bakery items, all the sweets. So many indirect sweets are there. Sugar is not just like that our table sugar. Okay. So
yes.
The things are very important. That should be also avoided.
Yes, doctor. The next question is, could you please provide some pointers regarding the intake of protein, calcium, and vitamin C for a vegetarian preteen to prevent deficiency? Basically, protein evlo, calcium evlo, and vitamin C.
Protein, I already said it is 1 gram per gram. So normally, in every adult or child, it is 1 gram per kilogram. Suppose suppose the child is preteen is 40 kg, means daily protein intake is at least 40 grams should be there.
Okay.
That is the thing. Suppose if we work if high physical activity, maybe increase to 1.2 gram per day.
Okay.
That is the recommended protein intake. Second one is the calcium. Calcium usually for adults we call it as 600 milligram per day, and vitamin C I think it is 75 milligram per day. But the main concern is I think if you are eating everything as usual,
balanced food.
I think the deficiencies are very rare, unless if you have the child has some restrictive or avoidant food habit. I think at least
fruit juices are fruit juices are rich in vitamin C. So I don't think you need a supplement as long as you are happy with the food intake.
Okay.
Yeah. Or else if you manifest some deficiency, then you can add on. Otherwise, blindly supplementing medications may not add help.
The allowed portion of fruits per day is at least 100 grams. So if you take 300 grams of vegetables and 100 grams of fruits per day, I don't think you will develop
exactly vitamin supplementation. So, you don't need to add.
Among the 300 grams of vegetables, how to divide is 50 grams should be a green leafy vegetable, and 50 grams should be your tubers, roots and tubers, and 200 grams will be other vegetables. This is how you have to divide the vegetables. But that is, I don't think that is practically possible. But if anybody interested in very much obsessed with diet, we can go for that.
Go for that. Yes, doctor. Yeah. And what tests need to be done to understand about body type and right kind of diet? I'm going to skip the second part because we've spoken enough about it. But what tests need to be done to understand about body type? Is that relevant?
Body type, I don't know. Probably they are mentioning about the pattern, which I didn't get that properly.
Okay, we'll wait for it. Probably the person can, at the end of the session, we just ask for more clarity. Okay, now it's going on to food sensitivity, doctor. My son eats crystal salt sometimes. What could be the reason? Should I address it in any way?
Crystal salt.
Crystal salt.
I mean, as we discussed, they have their preferences.
Sensitivities.
Some sensitivities and likes and dislikes. Children like crispy food, and many people don't. If you change that texture, they don't accept it. Probably our kid is probably taking, and the excess of salt is also not good. So for kidneys in a longer run. and it's very difficult, but you have to restrict that intake. I mean, you should not take that much salt apart from the dietary intake. In a longer run, there is a risk of developing hypertension and other issues related to that.
Yes, doctor.
Yes, yes.
The next one is he doesn't like sticky food. So again, another preference.
Your question probably.
Yeah, the sensitivity part. So
Yes, actually, it's a real issue. Actually, they don't want to touch anything sticky. Even if you force it in your mouth, it is not so. They will also spit it out. It's
yes.
a real issue actually. So only thing we have to get the great guidance of Durga ma'am.
No, I would say systematic desensitization is what we, generally from our purview we practice. As well as Ninga Solra Mari, look at alternatives like crispy food. Choosing your battles is the best form that we advise parents here. And Ninga Solra Mari, if we consider all the other aspects to be addressed, a balanced diet, right? And knowing what goes in, then maybe we can see how to manage it.
I share my personal experience this sticky food.
Yes,
my son used to take only idlis during the first 3 years. Accidentally, when we went to Kerala for some reasons, idli is not available. Out of hunger, he started eating dosa. And so anything if you want to introduce, make him
necessity,
make him fast and make him ask for it. One thing. Second thing, then after that he's not eating any curd. Curd pata he will run away, and if you put it in the mouth, he spit it out. So only the help of the occupational therapist, as you said, food desensitization.
Desensitization. Systematic desensitization.
Systematic. So they tried to put curd rice into his mouth, spit it out during his younger days. Slowly, now he is eating that systematic desensitization has worked for my child. Actually, it is a group of gastroenterologists, occupational therapists. Everyone must be involved in teamwork. It's a teamwork.
Teamwork, yeah. Yes, doctor. I would like to know why kids have so much laughing and humming post sugar cravings. Would you want to answer that?
I mean, it's very difficult to understand the process. Probably there may be a sensation of fullness, or probably something makes them to do so. I mean, it's very difficult. I don't really know that.
Okay. And how to find out any specific food intolerance or triggers? I think by the way we observe, this has been earlier seen, right? So, and how to go
specific test? No, there is no specific food intolerance. Only by observing and applying elimination diet we can identify.
Okay, doctor. And does junk food increase behavior, and healthy diet for teens? I think both have been seen earlier. And how to deal with acidity?
So, I mean, there is a way, like if we are convinced that there is an acidity, yes, there are medicines to help, but medicine is not the choice for a longer run. So we have to have lifestyle changes, or find out there is a bacterial infection called H. pylori which causes acidity, which is easily you can get through from one person to other, and particularly in our families, which we share utensils and things like that we get. So there are certain stool tests available to find this bacteria. If you confirm it, then there is a course of antibiotics which we can take and get rid of that, and lifestyle changes. I generally tell parents not to feed too much in the night time. Probably that gives a lot of reflux issues and acidity. Probably we can limit that way, and that's probably help them to. And particularly there is no food items really helps, but spicy food increases the acidity issues, but it doesn't cause us. I mean, if the child like us, spicy food, you don't think that it will cause ulcer. It's not true. If there is anything like an ulcer or acidity, it will bring it up.
Okay.
I think acidity, as Arul Prakash said, it's a common issue. we have to start with lifestyle modification. Physical activity is very important. At least 60 minutes of physical activity 6 days a week for our child may be doing one that. Another thing, some eating habits should have a proper meal pattern. Should not take breakfast one day at 7 o'clock, another day at 10 o'clock. So our system get confused. So you had a fixed time pattern for breakfast, dinner, and lunch. And we have to should not skip meals also. Should not skip meals. We have to drink a lot of water. Then certain foods can be avoided. Acidity means both. It directly indicates it can be a reflux disease or it can be an ulcer. So certain foods, as Arul Prakash said, you have to avoid certain foods like spicy food. Then carbonated beverages you have to avoid. Then you have to avoid some tablets. You cannot. Some tablets may
Over
cause,
the counter medicine.
yeah, some tablets may cause reflexes, aggravate reflexes. Then you have to avoid late night snacks. Okay, better to take 3 small frequent meals, and that late evening snacks should not be beyond 5 o'clock. Okay, out of the curiosity, out of love, we may give the child preferred food even at whatever the time. That will cause sleep disturbance sometimes. We are going to ultimately suffer. So that things are important, and you should not sleep immediately after taking the dinner. So at least 2 hours should be there between the dinner and the time to go to bed. Those things has to be followed.
Yes, doctor. And is avoidance the only way to combat food allergies? How do we train our bodies to overcome food allergy?
Yeah, I mean, it's even if you find a food allergy, like what we tend to say is like an systematic desensitization. What we have to do is avoid for a few weeks and reintroduce and see whether it's really.
Okay.
Some people may overcome it, and if you still have it, probably the best way is to avoid, or in some other form, or you can substitute through some other food. Like say, there are a lot of questions about milk and milk related products. If they are not tolerating that, not willing to take that, there are substitutes. You get protein and calcium in another food. I mean, some other food items also. So no need to force milk to them. So I think there are alternatives. Properly, we can get a dietary consult and we can sort that out.
Yes, doctor. And how can a lay person understand what causes allergies or inflammation? I think you have addressed it earlier. You know, the 2 types of allergy responses in our body. And can you suggest some simple tips? I would take that this is also being addressed, like avoidance, ruling out an allergy.
Okay. I mean, see, I think regarding allergy, we are born with that. So it's not like you can make a big change, but you can be safe by not getting exposed. That is the one. And if it is a milder form, like what we call it as intolerance, like allergy is a very, strong word, intolerance. We can avoid exposing ourselves to that and identifying and exposing. This is a huge task. But you cannot do anything to improve that because it's not a low immunity or high immunity. It's like directed towards something else. Okay.
External.
Yeah.
Yes, Dr. Chezhian, anything to add here?
Yes, as he said, his allergy is already discussed in detail.
Yes, doctor.
The only thing I want to add is allergy is mistake. There are 2 forms of allergies. Allergies, some anaphylactic reaction, like that we call it as oral food allergy syndrome. Suppose if we take a small quantity of that food itself, may cause a severe reaction. That is the real allergy. That sort of food has to be completely avoided. There is no reintroduction. But suppose if we have only minor symptoms like after taking the suspected food, if you have only abdominal pain, diarrhea, bloating, so such things may be investigated and may be reintroduced as and when needed.
Yes, doctor. So the next question is also addressed there. So I'm going on to the general questions that parents have. My kid sometimes laughs uncontrollably before voiding.
I think it's sort of a behavioral changes connected sense of comfortness or I mean, probably a stress related, like I mean, having
Coping
a full
also. Yeah.
coping probably, that's what. And I
Mm.
think it's not harmful. So I think it's a way the kids are
Expressing.
probably.
Yes, doctor.
No, it is may not be harmful. So cannot say that. But when we live in a community, so the issue may arise actually. So I think it may be the child may be very happy after emptying that
Emptying the bubble.
bowel. Maybe that sense of relief also causes, because I have watched our children. They express themselves completely whenever they are happy. They'll be very happy to
They
express.
have a
They don't have control over the society. They don't bother about the express whatever the place, whether in the toilet or in the hall or the public place. That may be the reason, but sometimes it causes issues in community living. So that we have to discourage. Actually, we have to. My advice to the parents is: suppose if your child expresses happily, laugh happily, you should not take it as he's happy. So in a community living, for future,
You have to teach
should
them
have some
sensitize them to that.
I know you are happy. I know you are happy. Please laugh slightly. Please clap only for some short time. You should control him.
Redirect the expression.
Yes, I learned it from Mira teachings only. You have to control, which is
Durga,
not
can I add here?
Yes, please.
Durga, can I just come in here?
Yes, please.
Yeah. So, doctors, this is Lakshmi here. So, I just wanted to clarify that what Durga was reading was about before pooping. And it's true of many of our children that they do laugh. And like the doctor said, that I think it's a way of coping, that sensation before pooping. And while I agree that it is inappropriate, I think maybe here coming in, it's a lot about communication also, probably, sharing with understanding how to redirect or indicate when I feel this discomfort is probably something that, but it is truly a form of communication to say that I'm either uncomfortable or I want to do this. In fact, it's a sign by which many parents understand that they want to pass. Yeah. Thank you.
Yes. Moving on, the other questions having been addressed earlier. Why are our kids prone to be deficient in vitamins and minerals? And can we take multivitamin regularly?
As we discussed, the issues with feeding makes children prone for nutritional deficiencies, either protein or carbohydrates, malnutrition, as well as vitamins. If you feel that, I mean, the best thing is to have a chart of a diet, what they are taking, and discuss with the dietitian once in a while. It's not on a daily basis, overall. So whether these calories are enough to run, and then vitamin supplements is required or not. But going for supplements is not always good, because all these preparations have an chemical preparation, and it has something adjuvant to it, which is not good. If you can manage with a diet, appropriate diet, it's very well and good. But the way to identify is to keep a chart of what and how much volume you give. Like say this much curd, this much dal, and this much rice, and this much vegetables, an average, and then in the longer run, you can discuss with the dietitian and see how much we are falling short. And then we can have that supplement.
Yes. Shall I go to the next question, Dr. Chezhian?
Yeah, I want to say certain things regarding
this. Multivitamin, doctor?
Multivitamin. Actually, we should not self-medicate with the multivitamin intake, because certain vitamins will, however the amount, how much amount we give, it will not cause toxic. Like B complex vitamins, nothing will happen. Whatever the amount you take, necessary amount will be absorbed, and it remaining will go out of our system. But vitamin A, vitamin E, certain vitamins will cause toxicity, and certain minerals also will cause toxicity if you take it in excess quantity. So self-medication is not correct. Majority of the children does not require vitamin supplementation if you are okay with normal food intake. Only few you have to see for the deficiency in the child. Suppose if the child has a vision problem, maybe vitamin A deficiency may be there. You have to check the eyes. Then if the child is not doing the physical activity, is not running or not working because of bone pain or muscle pain, then maybe vitamin D deficiency may be there. You look for the gums. If the gums are bleeding, maybe vitamin C deficiencies. So like that, you have to be aware of the, because we have to be aware of the symptoms of vitamin deficiencies and look for it. If it is there, then you can consult the doctor and go for the replacement.
Okay.
One other way is just to have a regular, when you go for a health check, probably you can, remind them saying that whether there is any evidence, like particularly the vision and all, it's very difficult to identify. So, that's the right way probably. Yeah.
Yes, doctor. And this question called explain difference sattamavu, ragi or kambu drink. I did want more clarity on traditional food.
Yeah, probably. I think, that's good as long as it's not any different from what we discussed, as long as they tolerate that it's a good food supplement which has good amount of protein and essential fatty acids. I think there is no harm as long as they like it and tolerate it. It should be an adjuvant to a routine thing which we are doing.
I think they asked for the difference between sattamavu, ragi and kambu, ma'am.
Yes, doctor. They are asking, explain the difference, sattamavu, ragi or kambu drink. I think they want
ragi is just ragi and kambu are just a small part of the diet only. Okay. But sattamavu contains everything.
Everything.
So sattamavu contains cereals, pulses, legumes, nuts, everything. So it's a balanced diet. Sattamavu is an example of balanced diet. But whereas ragi or kambu is just a portion only.
Okay, one part of it.
Ragi has good amount of calcium in it. So I think, we can encourage that as a portion. Okay. So when you are giving for a day, that's fine. In a week, you can have something like that.
Yeah. Yes, doctor. And they've just asked what is the sufficient quantity required for a 20-year-old and what is considered as overfeeding. The earlier part of the process should have answered that. We'll wait for some more clarity. And why is it difficult for them to know satiation? Dr. Chezhian,
Yes. I have few points. Chewing, lack of chewing may be one reason for absence of satiety. And our children also interpret the every response as hunger. Actually, if you are tired, they think that it is due to lack of food. They will eat. If they are irritated, they will eat. If they're happy, they will eat. So that is maybe the wrong understanding of our biology by our body, the children's body. That may be also a reason for the thing. And abnormal dysbiosis, abnormal gut microbiota, also one of the reasons for
not knowing.
Yes, ma'am.
See, overfeeding, it's very difficult to.
Prakash,
So overfeeding, it's very difficult to estimate how much. But it's a process, like say you have been seeing them for a long time. This is their stomach capacity and this is what required for them. It's very difficult to say which is overfeeding. But if you feed over, then they will have reflex symptoms and they may vomit and that's not good in a longer run. So it's very difficult, but with satiety, as Dr. Chezhian said, chewing makes them digestion and aware that okay, we have fullness, we have eaten something. They get a little tired after that. So probably something like
process makes it. Okay.
Yes, there's a condition called leptin resistance condition. Okay. So we have two hormones in the stomach. One is leptin and another is ghrelin. Ghrelin is the indicator of hunger.
Okay,
that is usually normal. Some children may have the leptin resistance. That leptin is responsible for satiation.
Okay.
Suppose the obese children, sometimes they have a leptin resistance. In spite of they have a overweight and obese, they may continue to eat more.
Okay.
And that may be a cause. We have to, if overfeeding is an issue, obesity is an issue, better to consult a gastroenterologist and investigate.
Yes,
that may give a clue.
Okay. And the last one here is there any proven link to gut flora and anxiety? And if yes, how to control one using the other?
So there is no big clarity towards this part. See, as I said, in irritable bowel syndrome, there is lot of connections which they have found with gut. But manipulating that will be very difficult. We cannot intervene in that part. So as we discussed earlier, to have a
Yes,
healthy diet and probably maintaining a good microbiota by avoiding antibiotics, and I mean identifying what is causing that anxiety, any particular I mean food item which makes them very uncomfortable and indirect. It's not direct. Anxiety is not direct many a times. And apparently, if it's troublesome, then you need some sort of medications to mellow it down.
Yes, doctor. I'm just quickly reviewing the questions on chat right now so
Yeah.
that we could move on to the next one. So the one was
Crozin,
does
paracetamol.
crozin and paracetamol based medicine?
Not really. It's not that bad
Okay.
medicine, paracetamol, but anything you are giving should have it's justified. It should be justified.
Yes.
Like, you are not going to take it every day, so no harm.
Yeah. Okay, doctor. And does FMT procedure followed in India?
Not extensively. And I mean, there are places where they are using for some other medical conditions called ulcerative colitis, which they have found. But there is, I mean, we have to wait for a long time because there is a risk of transmission of slow viruses and unidentified virus from one individual to others. Because gut has billions of bacteria. We don't know how much it will harm in a longer run. So I think we have to wait till it is established evidence and then that's it.
Yes.
I don't think in India they are practicing in many areas.
I think our children are only experimentally carried out with the FMT. It is not a well recognized indication at present. Only the research, maybe it is a research or experimental.
Okay, doctor. The second question there, does allergy to peas allergy means allergy to all legumes?
Not exactly.
No.
You cannot extrapolate, but it happens. It happens that similar group there can be, but it should be individualized. Otherwise, you will be losing that nutrition part.
Okay.
Test may be positive. The allergy test may be positive other legumes.
Okay.
But they may not be allergic. Should not. You can trial and error only will help.
Okay, doctor. And should deworming be done for young adults between 16 to 23? I think
if they are exposed, and I no harm in that as discussed.
Okay,
and we have a strong feeling like say itching in the perianal area, seeing worms in the stool, and probably they are feeling unwell and bloated feeling, then there is a trial of antibiotics. Yeah.
I think the general guidelines of 14 years is the cutoff for prophylactic deworming. But
yes,
but our case is different. So our children may not follow the proper toilet hygiene practices, and they may be keep the hands everywhere. So they are prone for it. Actually, even if our children are, my intuition says, even if our children are more than that prescribed age, they can take no harm in taking
it. Okay. I think that the fifth question is also being addressed here. So I'm moving to the sixth one. Some of our children bring back food even after an hour of meals and chew it back. How to deal with it?
It's a feeding disorder called rumination.
Okay.
And it happens with many people with neurological, even with normal development and other even adults. And it's like socially little unacceptable, but otherwise it's not going to harm it. So it's called rumination. Like they bring out this food and they don't have an hesitancy to spit it out. They just chew it and nutritionally it won't have harm. So I mean, socially it is not unacceptable. That's what the trouble is. Maybe we have to discourage that. As one of our parents who intervened who was telling that we have to teach them not to do such things because it becomes a routine and then repetitive behavior will keep on going.
It may be a sign of GERD also. It may be a sign of reflux disease also.
Okay.
Maybe if the child is obese and the overeating child, so maybe an underlying GERD may be there. We don't know.
Okay.
So we have to investigate if it is.
Okay. Yes, doctor.
That's what I want to add.
Yes, doctor. Thank you. And can you please suggest some probiotic supplements? You had mentioned it earlier. Is there anything over the counter?
naturally available probiotic supplements are very limited. I mean, whatever you do with curd and other
Yogurt.
like yogurt, and all have. If you are not tolerating that, there is something called Yakult which is available in market, which is reasonable there for a long duration of years. But I don't think I can endorse that. But
Okay.
you can have that. Yakult has a probiotic which has been used successfully in major, I mean, other countries. I think we can use that once in a while. I mean,
okay, doctor. And my 12-year-old son feeling nausea with few situation or fear, and he has a strong association with the feeling and situation. How do I understand his actual feeling of nausea and how to help come out of this association?
It's probably a sort of an coping
Anxiety.
Yeah. And I would say it is pretty much normal also. Feeling nauseous when you are afraid, typically a response that all of us have, right?
Maybe a personality.
It's like a tremor or tremulousness, feeling of tremulousness or increased urination. That is probably, maybe we have to treat the root cause.
Okay.
All right.
So we will wait for more clarity there. And what are the alternatives to this is done? Substitute for milk too, and my child doesn't like milk. Even if we mix it, anything, he identifies it and avoids milk always in any form.
Yeah, I think we answered that. I mean, if they have, not we have to, have a choice, then we have to go for another alternative instead of giving it in, or else desensitize them.
Okay.
I think there is a one-stop solution for that.
Okay.
Let him or her be a vegan. No problem. You can avoid. It can be substituted by other foods. They're still persistent with they want to give milk. You have to ask the help of Durga ma'am. Will you train liquids also, ma'am? That the food desensitization, systematic food.
Yes, doctor. Yeah, for everything we could.
Anything plus allergy or intolerance, you can desensitize. It's just introducing in a gradual
manner. Yes, doctor.
Whatever it is, they have to try it in early stage. As the age increases, it is very difficult.
True. So look at it as a whole picture is what we would really recommend. And if there are no other indications of food intolerance and IG test also normal, can there be food-related triggers for intense anxiety and palpitations?
Yeah, absolutely. See, the intolerance and IG test are not so foolproof. So still, I mean, it's you making a note of what is happening and whether there is a connection. You sort of have a food diary that will help you.
Okay, doctor. And doctor, my son has constipation issues always. Using castor oil will help him to loosen, and will this cause any problems? Is this related to IBS?
No, not really. Castor oil we tend to discourage because it washes out all of nutrients which is available in the food pipe, that is intestines. It just washes off. So you may in the longer run develop multiple nutrition deficiency. So go for other safe laxatives. And IBS is it's a broad terminology. Like I mean, it's very difficult to label that. And even though IBS is not going to have a discomfort or things like that, but it won't cause much of health-related problems except for the behavioral changes. Yeah.
And there's this neurological component, impact of giving sleep medication, and if not given, maybe like 3 hours, behavior gets disturbed.
Impact of giving, what is it, on regular basis? If not given, sleep may be like 3 hours or, absolutely. I said no, the sleep pattern is very important even for us. So they have a good sleep, they will have a good mood basically. So
right. I think the question here is is there an alternative to sleep medication? Because if the medication is not given, then they don't sleep well, and as a result, behavior gets affected.
Having a good physical activity, make them a little tired, engaged, and not to make them sleep in the noon time or take a small nap. Maybe you can push them to have a good sleep in the night. Probably that will help.
Right. And I think that has to be addressed as from the neural angle as well. If the medication is needed for getting sleep, I think that should also be accounted for, no, doctor?
Yeah.
Melatonin is not a great. Melatonin is okay. I think melatonin you can give. Nothing wrong in
Okay.
giving melatonin.
Oh,
It's
all
not
right.
not a pure drug. Maybe
Mm.
a hormone like. So that can be not issue. Other things are not good actually. Other sleeping pills are not good actually. But better,
Okay.
as you said, the physical activity
Huh.
and diet issues, if addressed properly, I think the child will sleep.
Yes, doctor. And if the IG test has shown multiple allergens, does the test need to be repeated? Do the results change? And after a few years, do I need to repeat the test?
Yeah, if it does show some allergy, maybe we can follow up with that.
Huh.
And see, the best way is to reintroduce, and if you are tolerating, that gives a good answer. Instead of going for the investigations, like say
Okay.
you are allergic to egg and you are giving the egg and you are not having much symptoms, then it's sorted out basically. So I don't think you should do it again. But if it is persistent, maybe you can do that and augment your thought process, saying that yes, I am allergic to this particular.
Okay.
That is IgE
All right.
test or
And
IgG?
doctor,
IgE test.
IG, no.
IgG, it says IgG, doctor.
So
Probably
I mean, probably there is whatever test which are available here antibody. So
Okay.
yes, IgG test is also done. See,
Ah.
IgE is a process by which mediates the thing.
Mhm.
The test which they are doing is antibody to something. Like say egg, antibody to the egg is present in our body or not. If there is a reaction, this antibody will be present. So that's fine. I mean, the food allergy panel which they do for whole people.
I think I already said this point: sensitization versus allergy.
Ah.
So the IgG test, the immunological test may show that may be positive in so many foods. That may indicate their body is sensitized to that food. That may not cause allergy. So only if the symptomatology is present to particular food, that has to be avoided. Not every food. And the test need not be repeated again and again. It's very costly test. It's not going to serve its purpose. And the best test for allergy, according to the allergy specialist, is skin prick test. They will do that prick test, not this immunoassays or that antibody assays are not. They are not rely on. They will do skin prick test. The particular food allergic means they will take that food and prick and look for the reaction. That is a basic skin prick test is there, and advanced component testing also is there. Those things are very important rather than this regular antibody test.
Yes, doctor. I think that brought us to the end of the last question and to the session. Thank you so much for your time. I'm just going to request Divyata to, over to you, Divyata, for thanking our special doctors here.
Thank you. On behalf of Team Meera and all the parents here, thank you so much, Dr. Prakash and Dr. Chezhian, for making time to address a very important concern for us. The presentation was very simple and very informative. And you both so patiently responded to all the questions here. And I think that was, we were all listening so patiently. And you also did, all the answers were clearly explained to all the parents. Thank you so much for being with us now.
Thank you for the opportunity, Team Ra, and thank you, Arul Prakash.
Yeah, thank you, Dr. Chezhian, and thanks, Team Meera, for organizing that. As we discussed, there are other dietitian and neurologists who are like, I mean, we can have a discussion and make it. I mean, I learned a lot from, because our exposure is very little. And thanks, Dr. Chezhian, to bringing out a lot of information. And yes, it helps us improving how to handle these issues. Thanks a lot. Have a nice
Thank you so much. We are going to take you on that offer, doctor. So we will be in touch for the neurologist as well as the dietitian. And thank you so much, Dr. Chezhian. Yes, thank you, dear parents. Yes.
Thank you.
Thanks, David. The session is closed, parents.
Yeah.
Team Meera, can we hang on?
Yes, we are hanging on.